Hey, what's up everybody? This is Adam Richmond, athletic trainer and owner of Precision Performance Therapy. Today I want to talk about ankle mobility and the squat. To effectively squat to parallel or below, it requires a sufficient amount of ankle mobility to do so and keep good form. So for example, as I squat down, you can see how my knees need to go over my toes. We need to have that ability to do so to maintain a good parallel relationship between the lower body or the tibia and the upper body. We don't want to see an excessive lean forward or arching or back rounding, and to be able to squat with good form, it requires that sufficient amount of ankle mobility. Otherwise, as I get to here and I run out of mobility, something else needs to give. So I round my back or arch hard to try to get lower through my hips rather than through my ankles. So today I want to go over ankle mobility, how to test it, and how to effectively remedy it. To test for ankle mobility, I like to use the half kneeling knee to wall exam. We'll do it on both sides, and we're looking for about 4 to 5 inches is normative value in the literature. I like to start at 4 to see if they have it, and then progress back to see how much they actually have, if they indeed have more than 4. But to set it up, what we're going to do is start with the toe at the 4-inch mark. I have a piece of tape here that indicates my inches and measurement. So I'm going to start with the toe at the 4-inch mark. The other setup piece that is important is that the back knee or the half kneeling knee is close to the knee that is, or close to the ankle that is being tested. If you have the knee too far back, it becomes a hip mobility issue. So as you're trying to rock forward, you run out of hip extension before you run out of knee or ankle mobility. So make sure that that knee is up close to allow them to fully express their ankle mobility. Next, we want to make sure that their knee is touching directly over top of the toes. We don't want to see it collapse in, and we don't want to see it go out there. We want to see straight over the middle toe and looking for about 4 to 5 inches of ankle mobility. If they're able to demonstrate that 4 to 5 inches, then I would say that their ankle mobility isn't their limiting factor in the squat. However, if they don't have that ankle mobility, there's 2 different scenarios that we need to talk about. Does it stretch, or does it impinge or pinch in the front of the ankle? If the athlete describes a stretching sensation in the calf or the posterior ankle, then we are going to be more indicated that the ankle mobility restriction is due to soft tissue or the calf musculature or the gastroc soleus. If you're feeling more of a pinch in the front of the ankle, we would call that closing angle pain, which would be indicative of more of an impingement of the talus not posteriorly gliding in the ankle and allowing you to go into that dorsiflexion. So make sure as you use this test, does it stretch or does it pinch? Your treatment will be based off of the fact that if it is impingement versus soft tissue stretch. If during our half kneeling knee to wall ankle mobility test, the athlete describes a stretching sensation in the posterior ankle or the calf musculature, we're going to go right into some long duration static stretching. I went away from this technique for a period of time in my career and have come full circle back to it, as it does get some really good results with ankle mobility. Specifically, if you have a true physiological shortening of the muscle tissue, for example, after a prolonged immobilization or after surgery, long duration static stretching is excellent to give signaling to the cellular, on the cellular level, to remodel and lengthen the tissue. So I would start with 2 minutes with a good old-fashioned slant board stretch. So you can get a board or elevate your foot with a plate, or however you can get the toes elevated. We'll get up on the board. I like to start with my knee straight. That's going to provide stretch to the gastroc muscle that actually crosses both the ankle and the knee. And then we're just going to lean in until you feel a nice stretch here. Again, I would hold this stretch for about 2 minutes, and then I would actually bend the knee and stretch again into that position to get more, or isolate more, the soleus that is underneath the gastroc and does not cross the knee. So by bending the knee, we get rid of the gastroc and now can isolate the soleus muscle. Again, holding this stretch for 2 minutes, as well as with the knee straight for 2 minutes. So a 4-minute total long duration static stretch, one with the knee straight, one with the knee bent. Directly after that, I would go right into more of a functional mobilization, what I call the knee to wall, standing knee to wall ankle mode. It's very similar to the test that we just did at half kneeling, but now we're up and standing. We'll get whatever distance away from the wall they had the restriction in. I would just back them up just a little bit. And then again, don't want to have that back leg too far back or restricting their mobility because of the hip. Make sure that other leg is up close. And all we're doing is just rocking the knee towards the wall. Find that restriction or find the area where you can no longer go forward. Hold it for a second or two and back off, and then go into that restriction again and back off and go into it again. I would do 3 sets of anywhere from 10 to 15 ankle rocks back and forth, trying to work through that restriction. With each rep, hopefully you're getting a little bit closer and a little bit closer to the wall until we can get to about that 4 to 5 inch mark on the half kneeling ankle mobility test. Okay, if during the ankle mobility test the athlete describes more of a pinching sensation in the anterior ankle or the front of the ankle, then I would start with this technique. It's more of a joint mobilization, or we're going to start with some distraction and then functionally mobilize the ankle with the distraction, hopefully allowing a little bit more space for that talus to posteriorly glide and get out of the way during dorsiflexion. So we're going to start with a band. Make sure it's secured to something solid, such as like a squat rack, or this is a Versa climber, shouldn't go anywhere. We're going to put our ankle inside of the band and wrap the band right around the bottom of the malleoli on both sides, or the balls on the outside of the ankles. We're going to then cross the band one over the other, again trying to stay below the actual ankle joint, and then we're just going to slide back and give it a little bit of distraction. So by pulling, the band pulling is going to hopefully distract the ankle mortise and allow some space as we go into dorsiflexion. We're going to take the other band and wrap it around the bottom of the foot, and I'm going to actively pull my toes towards me and use the band to give a little bit of overpressure. And then I'm going to relax and then pull back, hold for 1 to 2 seconds, relax, pull back, and relax again. I usually prescribe about 2 sets of anywhere from 20 to 30 of these. Again, usually this frees up a little bit of space inside the ankle mortise, allowing that talus to posteriorly glide and getting you into some better ankle mobility. So again, if during the ankle mobility test the athlete describes more of a pinching sensation in the front of the ankle rather than a stretch sensation in the posterior aspect, we have more of an impingement issue that we need to deal with. To help glide the talus posteriorly during the ankle dorsiflexion, we're going to try to use a band to provide that posterior glide and by using pressure, and then we're going to utilize a very similar exercise that looks just like the ankle mobility test to try to remedy this. So to set up, we're going to get a band again attached to something solid, and then the band should be placed right in the crease of the ankle. We want to step out and try to get a little bit of tension on that. And then we're going to set up again in half kneeling, making sure that our knee is close to the ankle so that we're not using or limiting the exercise with hip mobility. Making sure the band is right on the crease of the ankle below the balls. And then I like to use a stick and put it right in the middle of the foot, or even towards the inside just a little bit. And that will help guide the knee to the outside of the stick as we do the mobilization. That'll make sure that the athlete isn't cheating and allowing the knee to collapse in, collapsing the arch, and then what makes it look like ankle mobility, but really it's just a compensation through flattening the arch and valgus collapse of the knee. That's something we definitely don't want. So we want to make sure with the stick that the knee is being driven to the outside of the stick. Again, going to the restriction area and then coming back, and again, rocking forward to the restriction and coming back. Hopefully the band will provide a posterior glide to the talus, allowing again to free up some ankle mobility and get rid of some of that impingement. Again, I would recommend probably 3 sets of 10 to 15 repetitions with the band ankle rock.